I want to thank each of you for sharing those really important experiences with us, and I just want to acknowledge and hold space for the very serious and personal things that you shared, and just acknowledge that those did impact me, and I could feel, my body have a reaction and feel stress and at the injustice and the issues that you raised, and I'm sure that affected many people in the room, and it's important to acknowledge that, and again, express gratitude to each of you for sharing those experiences. And Dawnmarie, I appreciate you ending, with several different issues and some, in a sense, some positive notes. We are going to open the floor for discussion now and questions or comments. So we'll do that. I see a hand right here. Thanks. There is a microphone that is coming down the aisle.
I just wanted to say, I don't know if it's on. Is it on?
Yes.
I very much appreciate what you said, but all of you, I think abuse in the home, early abuse, that's the thing that our society needs to address a lot more. Once we can get rid of those root causes for poverty, then we're going to see some real big changes. Otherwise, history repeats itself.
Mm-hmm. Mm-hmm.
Yes, definitely. Thank you.
Thank you.
Especially for the men. My comment is to the women suffer too, but the men that are doing it are suffering as well.
Mm-hmm. Mm-hmm. Yeah, you've gotten right to a solution and a root cause, absolutely. Are there additional, or anyone want to follow up on that or on a different issue? Go ahead. Do you want to wait for the mic so everyone can hear you?
I work for an organization where we provide multiple services, and I'm always struck by the fact that so many of the women who come to our program say, I wish I'd heard about you sooner. And one of the conundrums for us as a program is that people in need often don't get access because they simply aren't aware of the services that exist. And I was very glad to see that you, for whatever reason, and it actually looked like it was by chance, that you found the service and so on and so forth. So even in terms of an initiative to really I want to say advertise, but show what really does exist, so it becomes easier for women to access whatever is out there to do so, would be absolutely helpful, because to not know is itself a tragedy.
Mm-hmm. Mm-hmm. And just to pick up on that a little bit, because sometimes at many of our agencies so I work at Family Service Toronto, for example, so we see such a demand for service as well. And we often, for example, there might be a wait list for some programs that, is not as responsive as we'd like. We have a walk-in counseling program at our agency for free, once a week, short-term counseling with a limited number of sessions. So how do we get to the other side of that in terms of the meeting the demand and the oversubscription? That's sort of the other end of it, I think. So I wonder if any of you have had experience where you couldn't, as you say, get the service or get the support you needed as timely as in as timely a fashion as you needed.
Women fleeing abuse do get priority housing. However, you're leaving violence to sometimes go into a ghettoized, community where there's more violence. And I truly believe that the subsidy should follow a person, that every building should have scattered units of subsidized units instead of having that stigma around housing. Housing, I didn't get subsidized housing, but housing is still an issue for me. And the cost of living in Toronto is just crazy.
Yeah, I'd like to say too, couple things like about accessing services. One of the things when I first moved to this city, and when you apply for social assistance or what, they don't make you aware, give you any reference like at the OW office, like this is where you can go for help, like for meals or help with your, or especially if you're a woman, a vulnerable woman on your own. You have to find these out yourself, and I was just lucky to find these, find out about sistering through word of mouth. Otherwise, I don't really know where I'd be right now. Housing, and also too, accessing housing, like I did when I was like living in the neighborhood where I was having to deal with a great deal of bullying. Even like I can remember one night walking down the street and this car going by singing out, "Die, bitch, die," and you know, like I was just like, you know, and I do really believe it was related to the person I had been briefly dating. But also, too, I put my name on the board for housing, the Toronto, yeah. And I put down, you know, that, you know, I was living in a place where I was fearful of community bullying. So I also believe, like, women in an abusive situation, it needs to branch out from taking it seriously, not just women who are living with their partners, but perhaps to women who are like afraid, men they've been dating or stalkers. I think this needs to be taken much more seriously as well.
Absolutely, thank you. It's just interesting to sort of, think about the needs that are unmet and the services that are out there, and sort of just get perspective from the panel. But thank you for your comment.
I thank you all for sharing your amazing stories. I've known about Sistering for a long time. It's a very unique organization. And I have a challenge for Women's College Hospital and for the audience here today. If every person sitting here this morning pledges $5 a month for every year for the next 3 or 4 years, it'll be a huge boost to the programming at Sistering. That's a small way we can all help. And I'm also wondering how Women's College Hospital can lobby the government in terms of increasing funding for an organization like Sistering. So I'm asking the Women's College woman over there in terms of what you can do to change policies to lobby the government for more funding for Sistering. Well, I like Sistering.
It's a very direct request, but it's a very good point around advocacy and the power we have to actually call for more support for services.
Did you get a response from?
Thank you for that request, and I'm unabashed about saying that we can and we would take it on. When we advocate for women, we're certainly not just advocating for Women's College Hospital and funding for Women's College Hospital. The stand that we've taken is that the issues that women face are much bigger than our hospital. We know that we have institutional influence in I'm tempted to say power, but I don't sometimes feel very powerful when we're dealing with our gaps as well. But thank you for that request, and I would say that Women's College would be more than happy to take that on.
We talk in the healthcare system a lot recently about the need for navigators. So system navigators to help people find their way through the many aspects of healthcare. If we were to take that concept and think about applying it to women's needs and relation to needing to be on Ontario Works or social assistance or ODSP, how might a system navigator work, and where would we want to place them? Because it's not a geographic place. What would be the best way of trying to get a navigator that would have helped you access and find the services that are out there?
I would think start right where women go first, usually for need or assistance. OW offices, ODSP offices. Perhaps if they could have some kind of advocate there, or some kind of advocate counselor, or somebody that women could make an appointment to see and talk more. They need to be given more information on where the agencies are, based on their need, because different agencies sometimes help with different needs. But from my experience, like, I wish I'd known about this, like sistering, when I first moved to Toronto. And so I think if we started right at the starting gate, right, in the OW office, find a way to say, this is, if a woman comes in, you have to give them this package. Put together some kind of information package, and when a woman comes, applies for OW, they're given that package.
That sounds doable.
I'd like to add to that. Yes, I really like that idea. Another place I think are shelters, because women that are navigating the shelters don't always have the same experience. And there's legal issues that come into play that you have to navigate yourself, and it's very, very difficult, especially when you're going through your own experience. But also there's mental health issues. And if someone told me about post-traumatic stress, at a shelter, the possibility, or have a package or pamphlets, things like that, I think I would have worked out a lot of issues a lot sooner. So definitely.
That's great. Great suggestions. Oh, sorry. Thank you. I couldn't see. Thank you.
Just a comment. As a healthcare providers, we know that basically poverty or the social determinants of health, those are the underlying factors which make people sick in the first place. I'm really happy that this program, this conference event is taking place at Women's Hospital, where, research, and we have loads and loads of research which actually shows that this is the underlying problem. What can we do collectively, along with the policy makers who want our votes, to make poverty the basic number one priority, instead of allocating dollars towards war on terror, on providing clinical care? How can we all come together and address these issues? I think that is one of the basic things, because the rest of the things are like Band-Aids, You can get small things done, but collectively, how can we all do that and address these issues by taking all the research that we have and making a case to the politicians to actually divert the dollars? Because without resources, these things are not going to change.
It's a big question. Yeah. Does anyone want to start a response? We can all do a bit.
But I can't answer that. We do a lot of initiatives, and I hope I get his name right, but Dr. Block, one way in through is he's created or helped, assisted, or has created a tool to treat poverty as a symptom. And that's another way where we can have our resources and help women because there are questions, and in this package that are addressed, what resources, what income, and things like that from our family doctors. That's a way to start. But as for government, I don't know.
I think also perhaps social media is such a powerful tool. So I really do believe the more agencies that would hop on to the social media, because it's so powerful. I think if more agencies, for example, had blogs and encouraged, or see if any of their participants would be willing to put a post up so that people would see, would hear. It's a way for especially like women's voices to get heard and to be much more prevalent. I really do believe that social media is a very powerful tool for advocating.
I would just add in response that I think we have to, as residents of our different communities, resist sort of divide and conquer and stigmatization of groups that are marginalized and people who are in poverty. Find ways to think more collectively and resist the sort of what's in it for me, or how will I benefit, and sort of think more broadly about the responsibility of government and about policy design, and policy design that makes sense so that it addresses poverty and that it reduces poverty, and that we are vocal about these things. So in our work as advocates, we often hear, oh, this isn't something I hear about at the door. Right? Everyone is outraged that there are so many children in poverty in their community, but I don't hear about it. That's not what people come talk to me about. They talk about other issues, right? And so it's sort of that there is, yes, a personal connection we have to government, but there's also a collective piece that we have as well, and we have to remain vocal about those things and actually demand better and keep up the sort of the noise or the fire about these things. And it's not one day a year or twice a year or just at the ballot box. It's an ongoing thing. And I have to say this event or this kind of discussion is one that hopefully will stay with people. Obviously, when you hear stories and you hear experiences from people that are so real, you can't help but remember them and carry them forward. And hopefully we do ask questions next time we have the opportunity to speak to our city councillors, our MPs, maybe even the Prime Minister, about how we need action more quickly and how we need action now for poverty. So